Hi everyone. So my paper is nature versus nurture factors contributing to bipolar disorder development. The goal of this paper is to achieve an understanding of the development of bipolar, either through its genetics or environment. Bipolar is often untreated and assumed to be other disorders, so it usually goes undiagnosed, which is why I wanted to take a deeper dive into this disorder. So first off, I'm Ava Katz. I'm presenting from my home in Richmond, Virginia. My amazing mentor was Ava Katz, and I chose this topic because I hope to major in psychology and want to better the lives of the people around me. I've always been interested in brain disorders and how they affect one's personality. My hope for this paper was to understand how bipolar is developed so future generations can prevent or limit the effects of this disorder. So first, let's look at what exactly bipolar disorder is. Bipolar consists of episodes of mania and depression, causing extreme mood swings. Bipolar can be very detrimental to one's daily life, causing suicide, aggression, impulsivity, and substance abuse. Typically beginning with depression, having symptoms of uncontrollable crying, fatigue, and overwhelming sadness. Eventually, symptoms of mania will develop with feelings of impulsivity and high energy. Let's take a deeper dive into this disorder. So the issues of those with bipolar are family issues, troubles connecting with others, social struggles, financial difficulties, and abuse. Disorders related to bipolar that often get misdiagnosed are anxiety and eating disorders, ADHD, PTSD, and borderline personality disorder. In bipolar, we have depression and mania stages, but in mania, there's different stages within it. So first we have hypomania, which is a sense of euphoria and full of joy, but also very impulsive. And then we have acute mania, which is grandiose delusions and hostile behaviors. Finally, we have delirious mania with hallucinations. For treatments, there are some mood stabilizers. So obviously, aside from therapy, these are another use. But first, we have lithium, which releases dopamine, reducing symptoms of mania. Valproic acid, preventing manic episodes by increasing GABA. And lamotrigine, which prevents depression through electrical signaling. So a main part of this paper is the nature versus nurture concept. So let's take a dive into what exactly that is. On the left-hand side, we see the nature part of the concept, which is the aspect that your genetics are the cause or change of a trait. The belief that you are genetically predisposed to certain changes or characteristics. Now on the right side, we have nurture, which is the aspect of environment being the reason for a change or trait to form. This is the idea that the environment, social, or mental issues are a cause. Your traits have been nurtured to be developed essentially. Both of these concepts have been a question for a long time in many experiments. So first, let's look at the nature aspect of this disorder, which is the genetic risk factors. The dilemma with this study is that it's difficult to pinpoint one exact gene for this disorder, as there are many confounding variables. However, it is proven that there is some hereditary inheritance. When both parents have bipolar disorder, there is a 50 to 45% chance their child will too. The question of its origins begin being hereditary, environmental, or if they affect one another. So first, let's look at some of the genes associated with bipolar. We have the CACNA1C gene, which affects the flow of calcium ions that are linked to mood regulation. Also linked to mood regulation are BDNF levels. When they are low, it can lead to depressive episodes. Then we have the ODZ4 gene, which deals with neurodevelopmental regulating the nervous system. Then we have the GRIN2B gene, which affects glutamate signaling, which is an essential function in brain and mood regulation. Finally, we have our last two genes, the clock and ARNTL genes, which both regulate circadian rhythms that are frequently dysregulated in the expression of bipolar. Now let's take a look at the nurture aspect, the environmental risk factors. Many environmental factors contribute to the plausible causation of bipolar disorder. It is crucial to understand the environmental factors that could trigger bipolar, as environmental factors can be preventable, in turn potentially preventing the development of bipolar disorder. First, we have neurodevelopmental pressures, which are maternal influenza during pregnancy. Influenza during the first trimester is correlated to bipolar 1. Then we have stress factors, which can range from home life, family loss, physical or mental abuse, and brain injury. Bipolar patients with more severe depression commonly report they suffer from childhood abuse. Parents with bipolar disorder can leave their child feeling a lack of safety and trust issues, passing on the struggle of this disorder. The last risk factor is substances. When abusing alcohol, it is linked to causing depression. Abusing cannabis is linked to the manic episodes. However, cannabis causes but also helps bipolar patients by calming symptoms of anger, sadness, and irritability. In the final analysis, bipolar has a strong impact on people's lives, both those with the diagnosis and those around them. This paper's goal is to reach an understanding of the causation for bipolar disorder, determining whether nature, the genetics, or nurturing environment causes mental illness. This research has shown the connection of inheritance of bipolar, but there are too many genes contributing to bipolar to know exactly which one leads to the disease specifically. Environmental factors also have a strong connection to bipolar. Further, empirical research is essential to gain a clearer understanding of the underlying causes and contributing factors, leading to implications in practice to prevent the disorder from prevailing. Thank you.
Thank you so much, Ava. Well done. Now, let's take a moment for audience question. Okay, we have one question. Ava, do you want to build on this research in the future, or if so, what would be the next thing you've researched?
Yeah, that's a good question. So, since it is hard to pinpoint an exact answer, I would want to research maybe exact cases and look at the mother's genetics and the environment and compare to see exactly which one is correct.
Okay, thank you. And we have another question. Do lifestyle choices affect bipolar as well?
Well, they can, because it can be a part of environmental risk factors. Obviously, there's many parts of environment that can cause the disorder. It's hard to know again exactly which one, but I think it's more typically being around a certain environment that causes more stress. So if there's a lifestyle choice that can cause more stress, it could lead to bipolar.
Yes. Thank you. And we have another question. Did you encounter any differences in the balance of nature versus nurture between bipolar 1 mania and bipolar 2 hypomania?
Yeah, so that's a really great question. Mainly, there's not too much of a difference. I've seen bipolar 2 is a little bit more extreme, so there are a little bit more genetics in that side of it, but there isn't much of a difference on the nature versus nurture aspect.
All right, thank you.